It's a real pleasure
Okay.
to be back with you all and to be back today. We're going to be talking actually about the role of youths in the advocacy for NTDs.
Okay.
And it's our absolute pleasure to welcome here today Maximillian Godwin Kilipamwambu. Maximillian, you're lucky enough to still be a youth, which is fantastic. And you are currently a student in Tanzania, and you're finishing your training as pharmaceutical technician at the Mtwara College of Health and Allied Sciences.
Yes.
In addition to that, you're also an NTD champion. You're working with the Youth Combating NTDs movement. But that's not all. You're a member of the Southern African Development Community Youth Forum Health Committee, which includes COVID-19. You are an entrepreneur, a philanthropist, a member of several other youth networks, including the UNCTAD Youth Forum, as well as a Young African Leadership Initiative member. So you have been extremely busy, Maximillian. You are championing lots of causes and bringing that youthful energy to all this. So we thought it would be really great to hear from you today, hear about your work in neglected tropical diseases, and also how youth will contribute to the future, of the sustainable development framework. We should remember that the youth, so people under the age of 25, are now nearly representing half of the world's population. Also, 75% of children worldwide are in just 10 countries. So this is certainly a force to be reckoned with. So Maximillian, I've loaded up your presentation in the system, and I'll hand over to you. A very warm welcome from all of us, and a big hello to all our attendees.
Thank you so much, Marianne. I'm so happy to be here. And as I'll be warming up the session, please kindly prepare me that poetry that I sent you the link, so that at least you can refresh in between to make our attendees happy and enjoying. So kindly get that ready to the video section, so that at the time I can load it, so that we can all enjoy the good poetry of fighting NTDs.
Brilliant. What a great way to start. Thank you so much, Maximillian. I'll just play that video right now.
Okay, thank you. Okay.
Mahatma Gandhi once said, "The true measure of any society is seen by how it treats its most vulnerable members." I've lived in two worlds. I've seen the wonders of the world. I've seen men go to the moon and back. I've seen men building the greatest wall. I've seen men drilling the deepest hole. I've seen men not asking for a cup of water but Wi-Fi passwords. I've seen men finding water on Mars. I've seen it all. So what's the need of men going all the way to Mars to find water, and a fellow man on Earth can't find water? I refuse to live in a world where it's easy for an army to disperse protesters with water cannons that have clean water, but it's hard to combat parasites that are living in water. I refuse to just stand and watch diseases with complicated names trying to complicate lives. It's sad to watch diseases that you only read about in theory being practical on bodies of the people that you care about. We can't afford to fail both on our biology exams and also fail in taking care of ourselves. See, where I'm from, our drinking water is not only polluted, it's also electrocuted. And if I tell you how many people die from drinking water, you'll be shocked. I refuse to live in a world where sewer lines, clean water lines, and illegal power lines run concurrently, apparently. I refuse to live in a world where men stay up late to watch 22 people kicking a ball, but there's a million people out there with legs too heavy, with the size of a ball, and nobody's having sleepless night. I refuse to live in a world where we have free waterfalls, but not free water for all. I refuse to live in a world that the water we flush in our toilets are 100 times cleaner than the water that other people are drinking. I refuse to be in a world where the water in swimming pools are getting a much better treatment than the water that our fellow men are drinking. And those are the things that make me sick. A man going without food for 3 days and that without water for 7 days doesn't make someone strong, it makes you weak. I refuse to live in a world where politician can go to the driest part of the continent to look for votes but not to distribute medicine or information to those that matter the most? If water can make it to the mountain, through rivers, to villages without proper channel, why can't men do that? I refuse to live in a world where creatures that can't be seen growing bigger than Hollywood movies and start creating sin. I refuse to stand and watch water taps running and others can't find water. If water is life, it's so sad. Now it's included in 1,000 ways to die. So when you go to sleep tonight, I want to think about the people with worms that even early bird are afraid to catch. And if faith heals, I think we should create more hospital in the church.
I want us to think of the neglected people living with neglected tropical diseases.
And a massive thank you to you for bringing us this amazing poem. It just summarizes what we're all feeling, I think. Thank you to Teardrops, the poet in question, and also to the Youth Combating NTDs group for sharing this fantastic video with us. What a great way to kickstart the discussions. Thanks, Maximillian. Yeah.
Okay, thank you so much. And I would love everyone to remain connected, because at the end I will cast you a short song I've made with my friend that will all take away with this kind of thing. So we are heading on to the presentation. So stay tuned, guys. So today we'll be discussing the role of youth in ending the neglect. And my name is Maximillian Godwin. I'm the member of SADC, Study of Health Committee, that it is working in the SADC countries here in Africa, in the southern African countries. And I'm the Youth Combating NTDs champion, the role which I got just recently. So I'm really happy today to join the International Society of Neglect Tropical Diseases in this Connected series, and I kindly welcome you all to be with us, and hopefully you can grab some wonderful things. And all youth who are here, so you're welcome to get the challenge and move forward. So the role of youth in ending the neglect. So hello everyone, I'm in great pleasure connecting with you all. Thanking the International Society of Neglect Tropical Diseases for this amazing platform. My name is Maximillian Godwin, all the way from Tanzania. I'm a final year pharmaceutical technician student at Mtwara College of Health and Allied Sciences, located at Mtwara region, found in the southern part of our country, bordering Indian Ocean. So I'm a self-motivation youth leader, Youth Combating NTDs champion, volunteer of health, advocate for NTD free generation, member of SADC Youth Health, including COVID-19 committee, entrepreneur, philanthropist, and member of several youth networks, including UNTAD and Young African Leadership Initiative. So I'm in a very good health despite of the global pandemic, and allow me to congratulate you all for surviving this deadly virus. I know some of us have lost our loved ones, including large number of healthcare personnel. Kindly allow me to extend my deepest sympathies and please receive my condolences. So, a few months ago, I had no idea of what neglected tropical diseases are, until one day when I was impressed with the appointment of our fellow Tanzanian, Dr. Mwelesele Malekela, as the new WHO Director for NTD department. I was curious to know what exactly this big-minded woman is going to offer to the WHO. I considered the great things she did when she was holding some position here in our country. So one day I got a chance to tweet Dr. Mwele. She's very kind in Twitter, so I urge you, when you're having NTD issues, you can connect with her. So one day I got a chance to tweet Dr. Mwele, asking her to tell me what really NTD is. I was surprised with a quick response attached with many useful information and links that gave me an opportunity to understand in details the whole concept of NTDs. So after receiving those all issues, I was shocked to learn that 3 billion people's lives are at risk globally. 1.6 billion people are already suffering from at least one disease globally, and 500,000 deaths if these NTDs are not treated. So she then gave me an invite to attend a launch of global movement of youth combating NTDs that happened in 27th of February 2020 in Dar es Salaam, Tanzania. So I'm trying to bring you together to understand what happened. I came to find myself in this NTD journey. Over 500 kilometers to Dar es Salaam by bus, we were like 5 kilometers because I couldn't wait to understand a series of popping questions like, how can this be that they are neglected? How do we not know about this? Is there any cure for these diseases? What exactly are they? Could I be suffering from them? Now, how can I help was the main popping question. Honestly speaking, that day when I attended the global launch of Youth Combating NTDs, changed me completely and cultivated my spirit for global health with ending the neglect as my priority. So focusing on me, my main priority in global health is fighting the neglect and ending the neglect of these tropical diseases. That day made me develop a sense that no one should suffer NTDs, and therefore with other youth, we committed to give our best to ensure. So I will recall what all youth attended that we committed to. So I myself with other youth committed, and I urge all youth listening this to commit in these 5 main things. 1, to end the neglect of NTDs and prepare for NTD-free generation by 2030. So by 2030, we must be already prepared for the NTD-free generation. Bring energy, our sense of innovation and skills with new technologies, thinking, and talent in the fight against NTDs, thereby contributing towards achieving the Sustainable Development Goals and attaining universal health coverage. Number 3, building an effective global community of youth leaders who fight NTDs. Number 4, use our voices and power to engage, empower, and support our communities to be part of the conversation. Number 5, empower youth leaders with the view of being actively involved in the work of the NTDs community in various capacities ranging from community mobilization to global advocacy and policy making. So I myself and many other youth committed in this. Now, we were introduced that day to the new NTD roadmap, which is expected to lead us for the next 10 years with inclusion of 20 NTDs, which are. So the new NTD roadmap 2030 shows the presence of 20 neglected tropical diseases. And now it is not that we'll be considering one diseases. When we talk of NTDs, we will be considering both 20 diseases. Now, by recalling, we include Chagas, we include Dengue and Chikungunya, we include sleeping sickness, we include Guinea worms, we include leishmaniasis, we include foodborne dermatitis, we include lymphatic filariasis, we include mycetoma, we include rabies, we include leprosy, we include scabies, we include schistomiasis, we include teniasis, we include trachoma, yaws, and Buruli Asa. So the goal of 20 diseases. Youth involved in this new roadmap is critical in addition to the collaboration. Now, one thing is that there are 3 main things if are considered in the new neglected in the new roadmap. The first thing is collaboration. The second thing is cross-sectoral engagement, and the third thing is partnership. So, despite of these 3 main goals of the new NTD roadmap, there is one essential thing, that is youth inclusion. So now we can consider 4 essentials of the new NTD roadmap is collaboration, cross-sectoral engagement, partnership, and youth. Dr. Mwele says, youth are the ones that have been that we have been waiting for the effective implementation of the NTD Roadmap 2030. So the NTD Roadmap 2030 shows that youth are the ones that are needed. She believes we are a generation to end the neglect. So if we want to end the neglect, it is us youth to decide to move on, and everything will be okay. Now, why do I find that Mama Mwele was correct? Dr. Mwele was correct, and I find that it is correct because, one, we are the biggest group making an influential part of any population. Youth are the biggest group making an influential part of any population. Second, we are the ones taking over the workforce now. Youth are taking the workforce now. Third, investing in future generation that is productive is in our best interest and will help to shape the overall economy. The other, being the largest and the most influential part of any population means we are also likely to be the most affected by these diseases. We are responsible for the success and the well-being of the future generation, that it's up to us to pass unto them an NTD-free inheritance. And lastly, not only will we change millions of lives suffering from NTDs, stigma, depression, disability, which can be caused by NTDs, we could also save $52 billion by 2030 in Africa alone by ending these diseases. Now, let's consider the following ways that I believe youth can end the neglect. So, number one, knowledge and use of social media. So this is how youth can play a role in ending the neglect. Number one, knowledge and use of social media. Nobody knows how to use social media like youth. The number of connections they have and the amount of time they spend on social media is invaluable contribution by any cause. Because of us, information travel faster and farther. Second thing, creativity. We are the creative individuals, and that storms for a place of passion where we want to see the causes we are involved in becoming a success. Our creative minds will point a picture of hope in any situation. Number three, our energy. We are highly energetic individuals, and we are able to use some of the energy to fuel a fire in the lives of people, and in the cases fight these diseases. Then we are big givers. Youth are the big givers of time, of resources, of money. Considering some reports, youth have been giving a lot in case of finances and many other things. And last thing is through leadership. The leadership in case of influencing policy. We see that many nations now are employing youth to take different opportunities in leadership, and we expect now youth can influence policies that can be used to fight these entities. So until now, I want you to recall many three things. The commitment we had, we as youth of youth combating entities. The second thing, why I believe that Madam Malekela was clear and was correct, believing in the youth. And the third thing, in these 5 thematic ways, that is knowledge and use of social media, creativity, energy, and we are big givers, and through leadership. So, I myself have been able to conduct some activities that I believe in one way or another have made an impact towards attaining an NTD-free generation. One, from February 2020, I've been using my social networks handles to speak of NTDs. I have dedicated 90% of my contents will consist of NTD issues. I have fed them with all necessary information so that whoever comes across will understand this concept of NTDs. Second, in a period from February to this July, I have been able to visit 7 local radio stations. This has been a great help to spread the awareness, provided many villagers get information through the use of radios. 3, in June, I won a small grant from Stanbic. My proposed theme was to get funds to equip me conduct an outreach program to spread awareness in several communities in our region. we were lucky to get additional support from an NGO called Door of Hope for Women and Youth that will support 2 more days of the proposed outreach program scheduled from 24th to 25th of July. Therefore, in 6 words, we expect it to impact 53,361 people, which is good as we start. Role of youth in ending the neglect. We continue. Earlier this month, I was appointed to the Southern African Youth Forum, SADC countries member states, to join the Health Committee. I'm preparing myself to penetrate the NTDs agenda into our discussions and ask youth in all SADC member states to improve the priorities towards ending these diseases. I have attended several webinars, and in all, I have never let the NTD agenda low. I have been finding ways just to chip in for further consideration. I was glad also to join the APSF Afro NTDs awareness campaign that lasted for 7 days and had a positive impact and response. I have been able to convince our college administration to prioritize and include NTDs in our curriculum. This has been already approved, and over 1,238 students will now benefit to learn NTDs in detail. We agreed to this because this will help to turn 1,238 students into champions of advocacy. The fact that they all come from different angles of our country will ignite the spread of knowledge of NTDs and save many societies and possible at low and cost-effective means. Most of them being youth adds value of youth engagement to beat NTDs. Now, the major means I see on combating NTDs is exposing them. We cannot fight these NTDs if we still hide them. We need to expose them. Taking this opportunity to congratulate International Society of Neglect Tropical Diseases for their effort of exposing these NTDs. Let's get to review and focus on some key important highlights on dengue. The International Society of Neglect Tropical Diseases is currently running a petition of making World Dengue Day a reality. Dengue is a serious and viral infectious disease, mainly spread by Aedes mosquito, causing flu-like symptoms which can lead to fatal complications. Incidence and risk of infections has dramatically increased in recent years. The fastest growing mosquito become the fastest growing mosquito-borne disease on Earth. Half of the world's population is at risk of infections or death. Now, I will share some experience of dengue in Tanzania, in our country. On March 19th, 2019, the WHO was notified of dengue fever outbreak in Tanzania. As of 11th of August 2019, the total reported cases since the beginning of the outbreak was 6,873 cases, including 13 deaths. Before 2019, Tanzania reported dengue epidemics in 2010, 2012, 2013, 2014, and 2018. In 2013 and 14, Tanzania experienced the worst dengue outbreak. The disease is under-recognized and underreported in Tanzania because of low awareness by the healthcare providers and lack of diagnostic testing and the systemic surveillance. Now, why do we need a dengue day? This slide tells it more. Like, why do we need a dengue day? We need a dengue day mainly. Why do we need a dengue day now? We need a dengue day because we want to increase the global considerations. You can imagine some other diseases are in a WHO calendar, but dengue is not there. So we need a global consideration. And if it will be placed in the WHO calendar, as the infographic says here, we are pretty sure that the consideration on dengue outbreaks will be prohibited effectively. So you can take a look on these infographics here for some seconds before I move to the next slide. Okay, now what a World Dengue Day would do? Okay, the first thing, the World Dengue Day would be ratified by the United Nations and WHO. The World Dengue Day will focus attention into the impact of dengue, motivate public health organizations and governments, demonstrate how concerned health policy actions can achieve significant benefits, minimize the impact of dengue, and reduce unnecessary death. Now, I can show you a bit of my work in dengue that I've been doing currently. So I've been advocating for World Dengue Day through my social network handles, and I've visited several communities to educate them and ask them to sign the petition so as to put dengue in a global consideration. In the college I'm studying, over 530 colleagues have signed the petition as we speak. Through change.com, I've been able to receive 117 notifications from people who responded by signing petition just after I shared the link. This gives me a clear picture that if youth use properly several advocating channels, we will surely end up in a reality of having World Dengue Day. From 24th to 26th of July, we will be able to visit 6 wards. We will prioritize to visit the health facility in the respective wards so as to share more knowledge on dengue to the healthcare providers so as they can improve their considerations. Now, as I'm winding up, I would like to invite you all to sign the petition of World Dengue Day campaign that will make sure this dream comes a reality. Now you can sign this petition through this link, through the upper link, and after signing, kindly share it to many people, many contacts as possible, so that you can be a champion of dengue. And slightly at the bottom of this slide, there is a link address directly that can help you to get a sign. So I welcome you to visit the International Society of Negative Tropical Diseases website, the www.isntd.org/world-dengue-day. This will help you sign many and possible. So thank you for joining us, and this is the end of my presentation. And I can recall for you in some parts area that you may think that I may be able to return. But main consideration that I would like you to consider is to why I committed to fight dengue. Why I committed, that is the very essential part that I would like you to consider. So after considering why I committed, you can now consider the other thing, like why I believe youth can take power. And the last thing is, now how can we do it? So I'm returning there. So I'm repeating this slide purposely to help you. So it is here. I'm repeating these 3 slides effectively so that at least you can be sure of what we are doing. That I committed to fight NTDs, and the youth we need to commit because of these reasons. Ending the neglect of NTDs and prepare for the NTD generation by 2030. So as we commit, let's know that by 2030 we need to have an NTD-free generation. Bringing our energy, our sense, and innovation. By committing ourselves, that means we are ready to bring our energy, our sense, and innovation. And the third thing is building an effective global community of youth leaders to fight NTDs. The first thing is to use our voice and power to engage, empower, and support our communities to be part of the conversation. And the last thing is to empower young leaders with the view being actively involved in the wake of the NTDs community. So this is how any youth can committing to give these issues. And why youth can be able to lead this NTD free generation campaign effectively, because we are the biggest group and an influential part of any population, because we are the ones taking over the workforce now. Investing in the future generation, it is in our priority. Okay, and being the largest group, that means you are even more influential, and we are even more at risk of getting these diseases. Then we are responsible for the success and the well-being of the future generation, and it is us to pass onto the NTDs free inheritance. So this is how youth can, this is how and reason why youth are suitable to run this NTD roadmap 2030. And the key major theme is that by use of knowledge and use of social media, by our creativity, by our energy, and the fact that we are big givers, and the use of leadership roles, we can really achieve this. So I thought proper to review those slides so that everyone can come across and understand this effectively. So thank you so much, Marianne. This is the end of my presentation, and I welcome for any question or anything that any of us would like to learn. Thank you.
Thank you very much, Maximillian. A massive thanks from us all here. You've really shown us through, for example, the example of dengue, how you've taken on all those qualities that you listed out for us of the youth and really translated that into very concrete actions. It's absolutely incredible that you got those signatures added to the petition. So that's very much an advocacy effort, but then also the fact that you are actually going in field into the wards, talking to healthcare professionals and possibly patients. You're moving very fast and you're really reaching those goals. So a very impressive presentation and a very impressive movement there that you are part of. So a huge thank you for that.
Thank you.
And we can't wait to see what you will be doing next. So you've had a very enthusiastic and international audience, Maximillian. People from around the world have tuned in to listen to you. I thought I'd say a quick hello to a few of them. Ana Muriel Jacinto is tuning in from the University of Perpetual Health System in Delta, Philippines. Hello, Ana Muriel. We've got Dr. Aftabuddin from Bangladesh. Hello. Saeed Fathi from Iran. Senu Adetunji Adeniyi from Children's Hospital in Sokoto, Nigeria. Hello, Francis Salaki from Uganda. And much closer to home here, Rita Oliveira. Hi, Rita, from the Children's Investment Fund Foundation here in London, and many, many others. I can't say hello to everyone, but it's been really lovely to have you join us from all corners of the world. So a very warm hello and shout out from London. At the same time, Maximillian, there's been some really good conversations on the chat while you were talking. You've given everyone things to think about. And so I suppose one of the first things would be to ask you, there's been a few questions here, and someone was wondering, Semu Adeniyi from Sokoto Hospital in Nigeria was asking, how can health education stimulate and energize the youth in the prevention of NTDs at a community level? So what have been some of your, maybe you could tell us a little bit about your experience or any activities or events that you put together, and what were your impressions from that?
Okay, thank you. So like how education has influenced my work, right?
And also how you might then go out and reach out in communities to make sure the youth who tend to be quite prone to NTDs, actually, how they can be protected and how can NTDs be prevented at community level. I think Semu particularly works with NOMA patients, and there's quite a big lack of understanding or perhaps even knowledge, awareness of the disease at all.
Okay, so I can start by saying that because these diseases, they are neglected, and most of even youth do not know them. So the first part of education is educating ourselves. We cannot reach the society if we do not know these diseases in details. And let me remind you one thing, that not only these diseases are found in a specific region or country. It may happen that a country is struggling to eliminate maybe 3 diseases and not only the 20. So the first thing, if we want to be good youth advocates, is to study and learn on ourselves, like what it is the NTD issues. So we need to study effectively to know the disease in details, then to know how they are transmitted, how they are prevented, then to understand the current situations in your country. You need to know that what exactly are you facing in your country. For example, in our country, we can say that we are fighting lymphatic filariasis, we are fighting dengue. So I will invest myself to study about dengue. I'll invest myself to study about lymphatic filariasis. So if you get to know them effectively, it's there then you can be able to transform the education to other issues. Now, the problem is that in many curriculums, especially for us who are in schools, NTD has not been prioritized in our curriculums. It's only communicable diseases and non-communicable diseases. So I urge those in schools to have an additional program to learn about these NTDs. So in order to be good advocates, it needs you to study about these diseases effectively. It's where then you can understand them, then you prioritize depending on what affect your area. Then you, after scanning, it's where then you can get out and give education to the society. So like when I first attended the global launch of youth, I devoted to study the 20 diseases effectively. And there I scanned what diseases do affect my country and irrespective of my region. So whenever I'm getting to the society, I'm going directly knowing what disease I'm going to speak on. So that's all.
That is a brilliant piece of advice, actually, Maximillian. Educate ourselves to make sure that any kind of outreach and engagement is really targeted to the community. So thank you for that. You're helping a lot of people, Maximillian, with your energy. And so we had a question here from Stephen Bramer, who's working in pest control in Canada. And Stephen was asking you, Maximillian, what types of help would you need from the international community to help achieve your goals?
Oh, wow. This is great. Thank you so much for your concern. Currently, what I'm looking forward is getting directly to the society. So the main issue may be the first thing I would love is to get a chance to learn more about these diseases. So I would love to fuse into a platform, especially to learn more about these diseases. I want to get more pieces of the 20 neglected tropical diseases. Then the second thing is to be supported to visit many societies as possible, because these visiting societies, it needs funds, it needs a lot of things to get to the society. So if I can get a chance to learn more about the NTDs, that will be the first help. But funds to visit these communities and associate many youth as possible in our places, that will be a global thing. And I would love to advocate in not only my country but in other countries as well. So with my experience also by visiting to our places can also be a good way to help our people. You know, it's not all about me, it's all about what do I get and to pass them into the society.
Absolutely. And Stephen also shared with us, it's not really a question, but I've just broadcast Stephen's comment to, hopefully it's come up on everyone's screen. I'll read it out as well. Stephen says that Max's 5 objectives for youth can be enhanced by building capacity in tropical nations. Youth can be turned on to NTDs by getting them interested in NTDs early in their educational career. Capacity can be improved by resource availability and building health medical education facilities, from grade school to higher education. There are qualified health professionals in these nations who can adequately train these eager and determined youth. So absolutely, I think we've seen this with the COVID-19 situation, that even very, very young children can be made aware and educated in fairly complex public health issues from a very early age, as long as there are, as Stephen says, the people there to make sure that this is presented to them right from an early age. So thanks, Stephen, for that. Quite a few comments, Max, were about basically community engagement. I've got here, unfortunately, I've just lost it while scrolling down. A comment, there we go, a comment by Dr. Aftabuddin, who's asking, as an effective approach, can we think of community dialogue approach as an effective practice in African countries, which I think has been done quite a lot. So community dialogue, so on the one hand, sharing awareness, building awareness about NTDs, but also perhaps hearing back from the communities. What are their health priorities? And perhaps in between the two, finding out a great way to further the prevention of NTD. So what sort of community dialogue engagement have you been involved in, Max? Were there specific events that you felt were really successful, or conversely, were certain things did you feel did not work as planned? What was your experience?
Okay, my experience in that is like we really need the community dialogues, because with community dialogues, it helps them to know exactly if they are affected and if they are not affected. And sometimes if you're having these community dialogues, for example, it broadens to know what exactly is the problem. For example, despite that these diseases affect, despite of these diseases affect this, we call them disease of poverty, and they affect mostly people in poverty. So the other issue that may affect them is that poor water and sanitations. So sometimes, if you come into community dialogue, you'll come to even to remind them for them to be responsible for the water projects in their areas, because sometimes people may not even bother to know water projects taking place in their areas. So if you remind them that these diseases can be resulted by poor water and sanitations, that means you remind them, in order for them to be safe from NTDs, that means they will have to take control of the water projects happening in their places. So this will help them to know, okay. So in my experience, that what I learned is that when we visit these people, we come to derive many other causative issues. Sometimes their leaders, they are not responsible. So that means that if we come into elections, now you can advise them that you need to get good leaders who will carry your health agenda. So it is quite very important, and I have witnessed it when I go to my outreach programs. We come to know other hindering and contributing factors for the fight of NTDs. So it is very important for community dialogues, because it gives you a sense to understand what else results or hinder the effort of ending the neglect.
Max, do you find communities will have a dialogue with you much more easily because you are a youth, compared to perhaps more official figures from, more senior figures from the Ministry of Health and so forth? Is your youth an advantage?
Yes, being youth, it pays a very good advantage, because talking of the officials, I'm living with them in the communities. So they're likely to respond to me better compared to the officials, because when they come, the senior officials, the heartfelt for telling them is kind low, so they cannot respond. So the fact I'm a youth, that means I'm a very influential part. So I will recall some few things, like why youth are important in this fight. The first thing we are the ones taking over the workforce now. So youth are taking the workforce. That means we can influence. That's one. Second thing, investing in future generation that is productive is in our best interest and will help shape the economy. So investing on the future of our communities, it is in our interest because we expect to live longer compared to the elders in the ministries or whatever. So investing in the future, it creates an opportunity for them to listen me more as a youth. The third thing, we are the biggest population. So I may talk to the 5, but the impact may be to the hundreds. So that's it. And we youth, we understand that passing the NTD inheritance, it is us. Because our kids in the future will come to ask us, why didn't you prevent us from NTDs? So passing that inheritance, it is within us. So the community responds to youth because they know youth are the key agenda to change.
That's fantastic. Yeah. What a huge quality. And we also, I think I've mentioned this before as part of the Connect, perhaps not to you, Max, but ISNTD, we also have a collaboration with a group of actors, and we have an intervention called Acting for Health. And again, like exactly what you were describing, it's really about removing those barriers to encourage a dialogue and really understand from the communities what they themselves are perceiving in terms of their own health. So we really loved your introduction with a poet and a poetry, and can't wait to hear your song to conclude the event.
Okay, no worries.
We, building on that, we had a good question here that was posed by Saeed Fatih. Saeed's tuning in from Iran. And Saeed's asking, there is a substantial gap between the burden of disease for NTDs in children and the research devoted specifically to this population compared to adult. What is your opinion on this?
Okay, there is a substantial gap between the burden of disease for NTDs in children and the research developed to this population compared to the adult research investment. Okay, so what I can say here is that, and that's why the concept of neglect comes. That's why they are neglected. And that's the issue. Because you find that because they were neglected, if something is neglected, that means even it won't work for the youth. And that's a reality. Because if they were not neglected, that means all people of ages could be considered in the issues of treatment, education, and what. So this is the effect of neglect. That's why now when we are coming up to understand that now we don't want to neglect them any longer, we start from the early ages. So now we can see that into the NTD new roadmap, it focuses in all, not only in youth or not only in elders. We focus with the young ages. So starting with the children's, now a lot of researches are being conducted to help them derive what's the effect of dengue and other NTDs to the youth. And now because what it is seen is that many have developed even this we call they've developed disabilities because of being neglected at the young age. Now, due to these researches, they tell us these people, because they were neglected at their younger age, now the effect it is seen in the adult age. So us as youth and us as agencies for fighting NTDs, we find it now the best way to end the neglect. It involves starting from the children up to the elders. So no one should suffer. The NTD roadmap focuses that no one should suffer. And if no one should suffer, now the researchers and everything start to be conducted to the children up to the adults. I agree with you that the most researches were conducted to the elders. It's because these things were neglected and elders started to ask themselves, hey, I'm suffering this, because we may find that the issues of like lymphatic filariasis have been seen more to the elders. So the research we are most conducted to the elders. But now concerning the new NTD roadmap shows that no one should suffer. So the researches are conducted to the youth, to the children, and to the elders. I think I'm clear.
Absolutely. And the good news is that, of course, even in terms of the treatments, quite a few of the big pharmaceutical companies are looking at improving pediatric formulations, for example, for a number of these neglected diseases. So hopefully lots of movement in that direction. Maximillian, we're coming up towards the end of the time allocated for our webinar. I know you also wanted to show us round off with a song, so perhaps we'll end on this very last question from Rawaida Bakri, who's tuning in from Saudi Arabia. Rawaida was saying thank you for your presentation, and what do you think, Maximillian? Would you plan to initiate a group of youth fighters that consist of young people from all over the world so they can communicate and share their experience? So kind of perhaps moving on from a very community and regional approach to hearing voices and challenges and exchanging experiences from all around the world. Or maybe you're already part of this.
For okay, I think by being a youth champion for NTDs, it has brought me already to a global community. So maybe I should take this opportunity to introduce to you a global movement of youth combating NTDs. It is already. So it is called Youth Combating NTDs. It's a global movement of youth around the world. So maybe for more details, you can visit youthcombatingntds.org. I think there is a need to share this link so that all youth can get a chance to chip in and understand. So for those using Twitter, you can search for Youth Combating NTDs. It is there. So there is already a global movement of youth, and I'm part of it. Though because I'm a youth, I'm working also with other societies. Like it has, yes, very good. So you can scroll down.
Yep.
Yeah, that's the website for all youth combating NTDs. So you can scroll down here. I think so. For all youth who want to be part of this global movement, they can apply here.
Brilliant. Excellent.
Yeah, they can apply here. Yeah, so you can apply here, and after you apply there, your request will be processed, and you can be recruited as the youth combating NTDs. Now, the last thing is that I can be used to advocate for the things. So if you find it proper, if you are youth in your country and you want to be part of it, I can give an access to that. So you can visit my Twitter. I'm using Twitter, so it is Maximillian Godwin. So if you get to Twitter, Maximillian Godwin, it's there if Marianne can help us.
Yep, I'll just I'll just share that also on the chat, and I'll hopefully in the next few minutes put it up on screen so as well.
If you get on Twitter, you can get me as Maximillian Godwin, and you can ask me anything about NTDs, and you can even welcome me after the issues of Corona and travel bans are over into our countries. Maybe you can come to sensitize. I'm ready, because I'll be graduating by the very early in September. So I think I'll be freely. Yes. So that's my account in Twitter. You can see there everything, all connections for youth NTDs. You can DM me, and we can talk a lot of NTDs. So after the travel bans, also you can welcome me. I can come for the sensitization programs of NTDs. Also, we can call for webinars like this, and I can share to you what it is to be a youth combating NTDs.
Super. Thank you so much. You're such a committed person, Maximillian. The energy has been really inspiring, and it's lovely to see. And I think you your presentation, but also your personality has really touched a lot of our attendees. We've had Dr. Peter Kioro from Kenya saying, thanks, a great presentation. Dr. Kioro works on Tangiasis. Dr. Winifreda Mponzi saying, nice presentation. Dr. Aftabuddin from Bangladesh saying, excellent, Max, thank you, and a new learning for the youths. Madi Bohani from Iran, thanks a lot, very interesting presentation, which was a benefit to me, from Dr. Bohani, Research Center for Heart Diseases in Iran. So you've really given us a lot of food for thought today, Max. It's been a pleasure to meet you. Unfortunately, we're running out of time, but as you all heard, absolutely get in touch with Maximillian through Twitter. If you want to communicate by email, perhaps get in touch with me or with the ISNTD. We can then forward that to Maximillian, and definitely by all means go to investigate and visit the resources of the Youth Combating NTDs website. And if you want to hear any more about these issues, the next WHO webinar is also looking in much more depth at the role of youth in NTDs, and this is upcoming. So please go and visit the WHO NTD website for any login details. So on that note, Maximillian, we'd like to finally give you one last massive thank you for your time today, for showing us what can be done from this completely new and fresh perspective with the energy of the youth. And we're absolutely going to watch this space. So wishing you all the best until we talk again, and a massive thank you. And any last words you might want to leave us with?
Thanking everyone who has paid this time. I know many people could wish to join us, maybe due to issues, maybe they view the things in your YouTube channel. So thanking everyone for your time. It really shows the great commitment, and this is togetherness that we all cry in order to end the NTDs. I would like everyone to keep an advocacy in the NTDs affecting their areas. Don't forget. And one more thing is that the International Society of Neglected Tropical Diseases is running a campaign of signing the petition to end the neglect of dengue and improve the global consideration. It doesn't cost you to get into the website and sign for the petition, because we all want the world to recognize dengue and improve global considerations. So by signing, just share, make your friends. For example, in my school, like I talked to the 530 something students, and they all signed it. And I've been sharing through my Twitter and whatever, and people are signing it. And that gives me feel that, okay, I can do a change. So I pose to you now and thanking you. Please stay healthy, stay focused, and Karibu Tanzania.
Absolutely, and thank you so much. Obviously, it's apparent that the dengue cause is very close to your heart. It's very close to our hearts as well. It remains a completely underestimated burden, particularly on the African continent. So it's really wonderful that you've been taking out this message, perhaps into communities and student groups that were just not necessarily aware yet of the burden. So on that note, yes, absolutely, I would encourage everyone tuned in to sign the petition if you haven't already, and of course to share it as Maximillian did. And on a wider note, by all means to carry on with the hugely inspiring points, action points that you've given us today, Maximillian. I think we're all going to take some of that with us today and go out and make sure that we continue to advocate, even if some people are very old like me and not lucky enough to be youthful, such as yourself. So wishing you all the best, Max. Stay safe, carry on your great work, and to all our attendees, same thing. Have a very good week, and we'll be in touch very soon. All the best to everyone. Thank you, Max.
Thank you so much.